morning. Hey kids, cats, and kittens. It is Dr. Heather Richardson from Bedford Breast Center. There's a lot of talk about using MRIs to screen for breast cancer. MRIs are great tests. They're probably the most sensitive tests that we have to find breast cancer, but they're also extra sensitive in finding other things that aren't breast cancer. So the downside of MRIs, they use a heavy metal dye called gadolinium. They have a very high rate of finding things that aren't cancer that then prompt additional imaging or biopsies. MRIs on a high-risk patient, for the most part, 15 to 30% chance of finding something that we want to look into that usually ends up not being breast cancer, and about a 10% chance of creating a biopsy situation. Fewer than usually 1% chance of it actually being cancer. So doing lots of MRIs on healthy young women that otherwise don't have cancer can kind of create some situations. So that's something we want to be mindful of when we're discussing use of MRIs for screening. Another thing about MRIs and screening, we haven't been able to demonstrate that women who have a lot of MRIs, that their outcomes are any different. People that have MRIs and have their cancers caught on MRIs still have a very high rate of requiring mastectomies or needing chemotherapy. So we haven't been able to demonstrate that it's changing the outcomes of care, or that people are living longer or having better survival as a result of these images. So it's thousands and thousands of women who have thousands and thousands of studies in order to catch actually a pretty small number of cancers. And of course, we don't want to miss anything. We absolutely want to take care of these cancers. But it's just something to be aware of when you're talking with your doctor about utilizing MRI for screening imaging. What we're really excited about here at Bedford Breast Center is we're getting contrast-enhanced mammography. It looks through breast tissue density, so even if you're not high risk, but you just have dense breasts, or if you have very busy breasts where your doctors are looking at lots of different things, it's really good at really zeroing in on where there's blood flow patterns and can show us what we really need to know, what might be cancer, and kind of looks through and looks past things that are healthy. So gives us all peace of mind to use that test. So we're super excited about contrast-enhanced mammography at Bedford Breast Center. So far it looks as though when we do studies and compare people with cancer with contrast-enhanced mammogram and MRI, it sees the areas of disease the same. So it looks like there's no disadvantage of trying to look out for cancer with contrast-enhanced mammography over MRI. But it's important to maybe have a further discussion with your doctor about the good things and the bad things about doing an annual screening MRI.